And then we took him through a progressive strength training program that ended with him really heavily loading his calves, like way more than he thought he was supposed to be doing.
Welcome to Athlete's Edge with Doc Dolly.
Smith grabs the puck and scores!
Providing athletes with a scientific edge in achieving goals and optimizing performance. We bring in expert healthcare practitioners and high-performing athletes to share case studies, cutting-edge research, and their invaluable knowledge.
Had him dead to rights. McDonough cross. They score! Nikita Kucherov!
Whether you're looking to enhance your training, prevent injuries, or reach new heights in your sport, you're in the right place. Let's introduce your host, from Rhinelander, Wisconsin, former collegiate athlete and owner of Motivation Health and Wellness, Dr. Jason Dahlquist.
They score! It goes in!
Welcome back to another podcast, guys. It has been roughly 1 year since we had Dr. Felicia here on the podcast, so we're bringing her back on to talk to you all a little bit more about running, and we're going to dive into a few different aspects. So essentially, first we're going to get into how her practice is going. She works with a lot of runners and endurance athletes. We're going to get into a case study that she has with one of her athletes and kind of how she started from the beginning, using the tools that she had towards the end, and then get those people back to running and what that really looks like for you or for that person in particular. And then Dr. Felicia has a running journal that she is going to talk all about, which is pretty cool. And then we're going to finish off with how her training is going and what she is training for at this point in time, because Dr. Felicia is a high-level triathlete, and I'm just curious how her training has been in the last year, races that she's been in, and what she's doing now. So, welcome back, Felicia.
Thank you. Yeah, it's good to be back. I can't believe it's been a year. That's a long time. It's flown by.
We talked a lot originally because we were both starting our practice roughly a year ago and building up. So we had that connection back and forth, talking a lot about business metrics, how we want to do things. So fill us in on where you're at now and all of the running things that you're doing with your practice.
Yeah. It's been like a year and a half since I opened my practice. So, that's kind of a big milestone, and it's been a journey. Like as with most business owners, you go through your ups and downs. You have your good months and your bad months, but it's always really rewarding. And this is what motivates me to continue is my passion for working with runners. And it's the business is going really well now, and I think just getting connected in Greenville has been really helpful. When I first opened my practice, I had just moved here, so kind of starting completely from scratch, brand new. That was a challenge, but it has all worked out, and everyone's been really receptive in Greenville, so it's been fun.
Is you're still, so Greenville, South Carolina, and you are
Right.
still at Anytime Fitness, correct?
Yes. Yeah.
Okay.
I have an office here, and then I can use the gym with my patients for all of our exercises.
Yeah, and you share a lot of the treadmill running type education. So walk us through kind of how all of that works with being integrated into Anytime Fitness.
It's honestly a really seamless integration. The gym owner here, he's been really receptive to collaboration and partnership, so it's a really good fit. But for using the treadmills, it's really easy. We've got like 6 treadmills here, so there's almost never a time I've maybe run into 1 or 2 times where all the treadmills are taken, but it's really rare. But yeah, that's where I do my gait analysis, and I have the software that I use with that. I'll take some videos while I'm doing the recordings as well. But yeah, the gym is a great way for me to have the higher level equipment. We use the squat racks, and maybe at the beginning we're staying more on one side of the gym where all like the mobility equipment is, and like bands and heavier things come later, but it's nice to have all of the equipment available.
And when you do your workshops, is that mostly at Anytime Fitness or is that out in the public or a little mix of all of it?
It's a mix of all of it, and then I also recently started doing some webinars.
Yes.
So I have yeah,
Yeah.
that's been really fun. I've loved doing those, and I plan to continue doing those. Everyone's got really busy schedules, and not everyone can make it to the in-person stuff. So the webinars have been a nice way for me to be able to record what I talked about and send it out afterwards. So that's been nice, but the webinars or the workshops here at Anytime Fitness are a little less running focused, and I try to um, give people more content that's, we're just related to everyday gym goers, and just people who are interested in health and wellness. But the running specific ones, I partner with Fleet Feet for a lot of those, and that's been really nice to be able to have that collaboration there.
Yeah, so your practice is Endurance Ally, and if somebody wanted to get onto one of your workshops or for the online webinars, I know you post them on Instagram, which is Endurance Ally PT,
Yeah,
something.
yeah,
Okay.
really simple.
Yep. So that way, if you guys wanted to jump onto that, because you're on the next one will be the third of a series for runners, correct? Because I was just on the last one, I just
Yes.
don't remember exactly what it was called.
Yeah, so this is like a three-part series I've done on performance, but from the lens of a PT, and my background being in mostly running and more recently triathlon. I come at it from a really unique perspective. So the first one was on biomechanics and efficiency, mostly around running. I didn't really get into the swimming side of things, but or biking. The second one I just did was on like managing your training load and preventing injuries and setbacks by like kind of managing your stress levels in terms of training, not really in terms of life. That's more of a psychotherapist, not a physical therapist, but plays a role. And then the third one that I'm doing is on recovery strategies. So that one's going to be September 9th at 6 p.m. It's like a Tuesday night.
Okay, so it's already booked, and
Hmm.
then we can put a link to that in the show notes here, so that way if somebody just listened to that and they want to sign up for it, they can. And it's free to sign up.
Yeah, they're
Okay.
free. And then if anyone wants access to the last webinar, they can just reach out to me and I can send it to them via email. I unfortunately forgot to record the first one, so
Oh
you
no.
know, learning curve to this webinar thing. I totally forgot. And but yeah, the second one is recorded, so if anyone wants to see that one on like training smarter, they can.
Yeah, which is great. What else do you do? So you got the workshops that you do at Anytime Fitness in the community, the webinars. We got the journal, which we're going to talk about that. What else do you do
Yeah.
kind of in-house with physical therapy and with your business?
Yeah, so the physical therapy I think is a little obvious, like it's rehab from injuries, but the thing that people might not know about that I offer is the injury prevention side. So creating a personalized like strength and mobility program for people. We do a really thorough evaluation of more running specific mobility and strength that you would need to, do endurance type running. Um, and then we're creating a plan based on what the findings of that are. So it is really personalized. And then that's the prevention side of things. But something I dabbled in recently was an 8-week strength training program for runners specifically. um, and as fun as it was, it is really hard to get 8 or 6 people, together for 8 weeks consistently. So I'm putting that on pause for now, just, for people's schedules. The summer is a hard time to get everyone on the same page, but,
Right.
I do wanna start that up again because people tend to struggle with the accountability and, um, really runners don't know where to start with strength training a lot of the time. Like people think they need to be doing band work or they don't want to gain a bunch of muscle and then run slower because they put on a ton of muscle. So it's sometimes it's hard to know where to start, and just having that established 2 times a week for 8 weeks, you're going to see the progress,
Yeah.
and it's going to be very applicable to your sport. So that's been fun.
Right. So the strength training side of things, you don't have to be in a specific sport. It's generalized across a lot of sports, but yes, you can get into the fine-tuning specifics with strength training,
Hmm.
especially like from the physical therapy side, getting back from an injury, there's always the return to your sport specific rehab and training that we do, which is like high level personal training. So there's not a lot of people that really know that we can do those things, especially being out of network, which is really cool that you're diving into the injury prevention side and the performance side without injury, because we can really fill that niche
Yeah.
well.
Yeah. I do think we come at it from a really unique place. That's a couple levels above just normal personal training. Nothing against personal training. I think there is definitely a time and place for that. But if someone is looking for like that next step and they're really passionate about running specifically, I do think we fill a unique role in that. It's
Yeah.
really fun for me.
Well, we have all of the case studies, which I hope you have a good one for us to talk through. Uh,
Yeah.
but we see so many of those throughout our job, and those people are hurt. So we have all of that knowledge of, okay, what did you do to get yourself hurt? So we're the perfect people to be on the prevention side to say, hey, if you keep doing this, you're going to be in the same boat that all of these other people are. And that's
Right.
why I think that we have that step above the personal trainer, plus a lot more education, biomechanics, screening, health, everything. We just it's a lot harder to go for to school for 3 years or 4 years of just a doctorate program than it is to just get a certification in personal training. But there are a lot of good personal trainers out there that can do very similar to what we're talking about. They just don't have the background in the physical therapy side of rehabbing injuries. So it's like they're missing a big component there. But nothing against them. Absolutely. We have
Right.
a CSCS here, so uh, certified strength and conditioning specialist that I work with here to do the 8 week strength training program. So very similar model to what you have, except I just have people come in to use the facility. She runs the strength training classes, and we've had everybody from runners to CrossFitters to join the class, and it's set up very well. And what we did was specifically for strength, like that you're going to get stronger in core lifts, and you're going to learn how to do them
Hmm.
appropriately, and then you can
Yep.
apply it outside of that to specifically what you want. Uh, but it is tough, like you said, to get people and fill those classes, because it's like, hey, you're making a commitment from this amount of time. You have to be here.
Exactly. Yeah. And it's a financial commitment too, and they don't want to miss the classes if they're going to financially commit. So,
Right.
yeah, that's one challenge. I still want to toy around with uh maybe there's like a um ongoing enrollment, like where you can just kind of join the classes at your leisure,
Mm,
like when it's a good time to start for you rather than on a specific date. Anyway,
right.
yeah, it was really cool. Kind of going back to what you were saying about like the personal trainer that you have at the gym. The gym owner here actually ran the class with me, and he came at it from a unique perspective. His background is in powerlifting, so
Okay.
he had a lot of knowledge on like the basic compound lifts, and that was helpful to get his perspective. And then I came at it from more of like the running specific exercises and then the biomechanics side of things too. So like you were saying, like with a squat, there might be things that I picked up on that, Charlie might not have noticed just because we have the training in the biomechanics and like noticing someone's
Yeah.
ankle mobility in relation to how deep their squat is. That those are the sorts of things that we looked out for each of the people who joined the class, which
Yeah.
I think, appreciated.
Yeah, absolutely. The compensation factors that people have, and if you're not trained specifically in those for certain movements, people get injured. Even if you are in a training setting, people will get injured, which is it was cool. I filled in a couple of times for our coach here because she had to be gone, and it's just the perspective that they get from somebody else is huge for certain things, and sometimes the way it's just worded or uh, what you're doing in that particular day, something just clips or clicks inside their head with the certain movements that they're working through where it just didn't resonate. It's the same thing with any sort of education style training program or even just in school. Like one teacher may have said it this way, and you're like, what are you talking about? And then another teacher's like, oh, well, that was easy, but it's the
Yeah.
same exact thing that you're doing. And sometimes it's just nice to have those different perspectives and having different providers really kind of focusing on different things coming from different backgrounds. That can give you a completely different insight on the same exact thing from multiple angles, and the outcome's really well. Like, it's good.
Yeah. Yeah, I totally agree. I had a very similar experience with me and Charlie. It was good to get two different types of coaching styles and two different inputs, and some things clicked for some people, some things clicked for others.
Were,
Um,
were you both
it's
there at
cool.
the same time?
Yeah, yeah.
Okay.
So we had a group of six, and we kind of split the group up into three, and one person would do watch squat form for one group, and one person would be watching the squat form for another group, and then we'd move on to the next exercise. There was only really two exercises that we could superset with, which is when you pair exercises together that work different muscle groups, and you're using, um, I'm just saying this, I know you know
Yep.
this, but for anyone listening who doesn't
Right.
know this,
Yep.
but um, yeah, you're using that other exercise as your relative rest, but you really can't do that when you're doing heavy lifts because your nervous system needs to recover. So, anyway, there was just a couple of exercises that we could actually do the supersetting with, but for the squats, we took like 3 minutes rest in between, and then I could watch another person squat in that rest.
Yeah, I'm gonna boost your class here for everybody that's listening. The one of the biggest things that people don't realize for some of these smaller classes, so even 6 people in a class is a lot for one coach. But to have
Oh,
two
yeah.
coaches and talking about form and looking at different things, so making sure everybody gets that attention, there's a lot
Hmm.
of value in that. And
Yeah.
people don't realize it. So we cap our classes at 4, and the sweet spot is usually 2 for one person. So it's like
Yeah.
but yes, you can do it. It just depends on the structure that you have. If you have something really high paced, then obviously you're going to want to have closer towards the one provider to one athlete because it's like you just can't watch 2 people doing really fast activities or moving from one thing to the next and make sure form's good and actually educate and teach without
Hmm.
stopping their workout altogether.
Hmm.
So there's a science and method behind how much instruction or like how much help or support you have between like one person and or one coach and two coach with
Yeah, as a coach, you definitely have to get comfortable multitasking a little bit,
Mhm.
but make everyone, I always want people to feel like I'm paying attention to them. They're the only person in the room when I'm with them. Um, that's the kind of quality that I think both Charlie and I really strive for. So, hopefully our athletes felt like that. I think they did. But
Yeah,
we ended up personalizing a good bit of things, like giving them different cues for whatever works for them. And then there was a few exercises like plyometrics. That's something that we added, which is something I insist upon for
yeah,
runners for their strength training. So what ended up happening is we started off with all the same everyone doing the same plyometric exercise at the beginning just to get them used to some impact. And then as we went along, I kind of learned what everyone's deficits were and where some people might need a different plyometric exercise versus another person. So that ended up getting a little more tailored to the individual, which was kind of nice because you don't often get that in big group classes.
no, you don't, especially to have a set program. I usually think that it and a set time length, people are going to get more out of it, and you can give me your opinion on this as well. than if they were to just kind of pop in here and there. That's why I think a set program is way better, because we're like hyper focused for this amount of time to get this result. So,
Hmm.
and then it's like, okay, well, all of these little things. So you find the deficits as a good coach, you make those tweaks throughout the program, but we're still pretty like it's within the same umbrella to get this result, which is awesome. But I will always say, like, hey, if you're going to be picking and choosing something, to have a set program or schedule to follow and then make adjustments as needed for a specific amount of time, that's going to get you better than, well, maybe I do this one workout here and there at the YMCA for, a month or two and then kind of reassess where I'm at. You're not going to have the accountability. The effort's not going to be what it needs to be. And then you're going to quit on yourself, because our brains do that, especially as endurance athletes. We quit on ourselves way sooner than what we're supposed to. And I actually participated in one of the 8-week programs that our coach put together, the very first one. It
Awesome.
kicked the shit out of me. Like I learned that I was not doing things enough. And I'm an athlete, right? So and most people, they don't have that intensity, so the results are minimal.
Yep. Yeah, that was something we really harped on in the strength training class was like, we want everyone to lift safely, obviously. So form is number one priority, and then we're gradually getting them to the spot where they can lift heavy. But you're really not going to see the results that lead to injury prevention, and improve running economy, and bone density unless you're heavily loading.
Yeah.
So it was something we really encouraged. Going to your point about like kind of being all over the place with different classes and stuff too, like I think just the human brain gets bored pretty easily, and maybe this is getting worse with their social media. But yeah, we tend to kind of like bounce back and forth between different exercises, but just establishing it might be a little bit repetitive and boring, but that's really is how you gain strength is by doing the same exercises week after
Yeah.
week. And progressive overload is the name of the game. But yeah, you just have to establish that routine, and maybe some of your rehab exercises can change from time to time, but those like core lifts, they should pretty much stay the same.
That's why they're the core lifts.
Exactly.
Yep. You see them in every sport, and they need to be the foundation. You need to have a good foundational, like, base of strength, and then from there you tweak in the sport specific stuff.
Exactly.
Yeah.
Yeah.
So, well, let's transition here into a case study. Do you have somebody in mind?
I do, yeah. And it's actually someone from the strength training group that I had, but he was a patient of mine before he joined the strength group. So it was really cool to see his transition into that. So he came to see me for a calf strain, recurring calf strain that he had as he continued his runs. The longer distance he would go and the more hills he would do, this might seem obvious to you and I, but the hills were a really big aggravator for his calf. So we talked through what those aggravating factors were on his first appointment. We did that strength and mobility assessment that I bring a lot of my runners through. Obviously, it was more, specific to the foot and ankle, but for him, it was interesting because he actually had like a difference in his hip that was making um, altering his running form a little bit. So we were trying to address hip strength as well, which might seem totally off base for someone with calf strains, but that was something that we found was playing a role in why he continued to get them. So we did some dry needling just to get his pain levels down initially, improve some blood flow, promote that healing process. And he was a little bit stiff in his calf, so that helped with that as well. And then we took him through a progressive strength training program that ended with him really heavily loading his calves, like way more than he thought he was supposed to be doing. Um, and doing some plyometrics too, which was new for him. He struggled. I find a lot of distance runners kind of struggle with the coordination of like plyometrics and like finding a rhythm. So it's something we worked on. Just a funny kind of runner thing. But yeah, I think it was like 2 months later that I did the strength training group and he joined for that. Um, and his calves have been good ever since. He just ran a half marathon a couple months ago, and then I think he's in another half marathon group at the moment, training away. It's been good.
That's awesome. Being in Greenville, I don't know if anybody listened to the podcast before, but my last clinical rotation was down in Easley and Central, which is very close to Greenville. This was before Felicia had her business, but I ran on the good old Swamp Rabbit Trail a lot, and they have a huge running communication, or just like active communication, but the running community, not communication, brains out
I
there
know what you
today.
meant.
Yeah,
I know what you meant.
community is big. Like the run groups down there, they have like a lot of people in the run groups,
Mhm.
which is super cool to
Yeah,
see
that was
it.
one of the things that drew us to Greenville. And I'm sure I said this. I can't even remember what I said the last podcast, but it was a year ago now.
Right,
So
right.
yeah, that was one of the things that definitely drew us to Greenville is we're just really active. And we the first time we went on the Swamp Rabbit Trail, there was traffic on the bike path. I was like, all right, I think this is a sign. Everyone here is really active too, so we'll
Yeah.
fit right in. It's been really good.
Well, they got miles and miles of like paved trails, which is
Hmm.
so cool. You don't see that, and they're nice. They're not just these bumpy, junky
And
things.
they're
Like they're
expanding too, which
are
is
they?
really cool. Like, so yeah, they're expanding in North Carolina, going from like Hendersonville west and then like just south of Hendersonville going east. Yeah, it's taken
That's
off.
cool. So if you're somebody listening to this who wants to move to a really nice active area,
Yeah.
Greenville's a great spot, and there's a ton of little smaller places around Greenville too. If you're not like, hey, I don't want to be right in the center of a busier city,
Yep.
but yeah, they
Yeah.
have a nice network of things down there for sure.
Yeah, that's where we're at too. We lived in the city for a year and then we moved up to Travelers Rest, which is like 20 minutes north of Greenville, and it's a really small. Yeah, I don't think you can call it a city. It's a town. But it's like right in the mountains, which we love because we cycle too, and it's a great starting spot for a
Yeah.
lot of routes.
Yeah, absolutely. I want to circle back to the dry needling that you did early on to help with pain,
Mm,
blood flow, healing. When you
yeah.
did the dry needling, because you talked about his calf pain, and that's kind
Hmm.
of like the majority of what was holding him back from running, moving forward. But you brought up his hip pain too, and having issues up there with more strength. Did you do the dry needling more in his calf just to help with pain there, or did he need it up further as well?
So he didn't actually have hip pain, but he had hip mobility deficits,
Okay.
and that wasn't allowing him to get full extension at his hip, which meant that he was basically just using his calves for push off. Um, if you know anything about like if for people listening, if they know anything about the gait cycle, like when you go into extension at your hip, you have a bunch of muscles that help with your push off into the next step, and your calves are a big part of that, especially for distance running. The soleus is really big, but you should be getting a little bit of activity at the glute and hamstring as well. But because he was lacking that hip extension, he couldn't really get good push off from the glute, and so we didn't do any dry needling up there. We did a little bit of work on his hip, but the dry needling was really more for pain modulation and trying to get a little bit more mobility from his ankle.
Okay. The so we're gonna dissect this a little bit. So when you say mobility at the hip, so it's the extension part where you push off, so your leg is should be well back behind it. Was the mobility coming from a restriction of tight hip flexors on the front side of the hip, or is it more of a weakness in the backside, or a combination?
Combo. Yeah.
Little
I would
combo.
say, oh, what came first, chicken or the egg? Is
Mm,
it that he didn't have the glute strength and then he wasn't using his hip in that full extension? Um, I don't know that we really know that, but we did address the hip flexor tightness, and then once we got a little bit more mobility from his hip, we were able to use that new mobility to do more hip extension based exercises.
So when you work through mobility with people, is it active mobility? Is it passive stretching? That's a common question that I get. I'm curious to see how you approached it in this case.
Yeah, I think that's evolving in the field of PT. Like, I don't remember when you graduated from PT school. When did you graduate?
It was 2023, so about 2 years ago.
Okay. Um, in 2019, like passive stretching was definitely still being taught. I think in the world of sports PT, we're getting away from that more. Because there's this theory that a weak muscle will protect itself by becoming tight. So I do try to do more like active mobility drills before runs. And then I'm still not like sold on the fact that like passive stretching is not helpful at all. So um, I did have him do some hip flexor stretches after his run. But beforehand, I was emphasizing more of the like drills and maybe using like a foam roller, something where he's not just putting stretch on a muscle that hasn't had any activation to it yet.
Hmm.
Um, so that was what we focused on before runs, and then the passive stretching more after runs. He really didn't have hip flexor weakness, so I don't think that was the reason behind his hip flexors getting tight. Um, if I do find that though, like if I have someone who comes into the clinic and they're really missing hip extension and I test hip flexor strength and it's super weak but also tight, that might cue me into okay, maybe they're tight because they're weak and we should be strengthening in that full range of motion. But if someone has a really strong hip flexor and they're still really tight, I kind of lean more towards the passive stretching active drills, but then passive stretching after the runs.
Cool. Say there's even strength training drills. So we know the Thomas test position is
Right.
it's to test kind of the muscle length of the hip flexors. But even if you like in that position, you can activate the muscles. So if you ties a weight to somebody's ankle, or have them stick their foot through a kettlebell, it's one of my favorite ways to stretch it. So for people who are listening, that's where you lay on your back, you bring one leg up toward your chest and you hug it. The other leg you let drape over the top of a bench or down towards the ground. So you need to be up on a kind of an elevated surface. And then if you loop something, or so if you put your foot through a kettlebell on the ground, you should feel a massive stretch. But if you have that and you lift it up in the air, you're going to activate the hip flexors, and then you just relax it down so that hip flexors are still working. It's just you can get into a more of a stretch position there too, so you get a little bit of strengthening and stretching at the same time. And I find like that's a really good way to do things too. And obviously, there's ways to do that for everybody's individual case. We can't just do that for everybody. And it's interesting to hear how people approach everything, because that's how we all get better. And it's like I want to take that idea and put it over here with this person. Um,
Yeah.
did you need to do any joint mobilization? So if you found that it wasn't specifically his hip flexor strength and the length might have been okay of it, was it more the joint that was restricting him then?
Well, no. So he had a strong hip flexor, but his hip flexor was still tight. But then
So,
we
okay.
tested separately. We tested the hip joint, um, and that was fine. He had good hip extension from the joint itself.
So you work more just on muscle length, which for those listening, there's multiple different ways that we just discussed. There are things that you need to look into to make sure you're getting that joint range of motion. So it could be the strength
Yeah.
portion of things. It could be that it is actually strong, but it's still tight. So then we would need to stretch it versus strengthen it. And then
Hmm.
the joint mobility itself could play a big factor, or just the opposite muscles. Like, so the glutes would be the opposite of the hip flexors. And if those are weak
Yeah.
and you're just not strong enough to pull it back, then we need to strengthen those. And then, so that you have this multiple avenue approach to getting that same thing. So there's a lot to look at and dissect out of just, oh, we had to get more hip mobility. So
For sure,
that
and
was
that's
good.
just for someone who has a very obvious hip problem, but then you're looking at someone who comes to you with calf issues and,
Yep.
oh, okay, we just discovered something at the hip that's affecting the calf. How is that possible? So, yeah, there's so much that goes into it, but yeah, I do think distinguishing between muscle tightness and joint is where we shine, and something you might not get from just doing like searching for rehab exercises online or following the newest social media trend for how to get your ankle to move better. Like you might just be missing what's actually the problem for you.
Yeah. The root cause. Tie us
Right.
into the running gait analysis and kind
Ooh.
of how you did, because did you do one with this patient?
Yeah, I tend to do them for all of my runners, and I try to put runners place a lot of emphasis on the gait analysis. I think maybe it's from um, what they've heard when they go to get shoes is like the overpronation stuff.
Yep.
But I try not to change people's running form unless it's absolutely necessary. But for him, we didn't change his running form. There were definitely some things that I noticed in his running form, namely that lack of hip extension and him only using his calves for push off, or really mostly using his calves for push off. Um, but and then he also had like more impact loading on his injured side, which is kind of a cool thing about the gait analysis software that I use. So I use a software called RunEasy, and it is measuring with an accelerometer that you put at your hips. It's measuring your impact, it's measuring your dynamic stability at your hips, and then the symmetry. So it's just comparing all that data side to side. But the impact loading, you can kind of separate into how hard you're hitting the ground and how long it takes that force to travel from your foot to the sensor, which is a good indication of how good your muscles are at absorbing shock and whether your muscles are doing that efficiently or if you're just kind of relying on bones and joints to absorb that impact, which we know can lead to things like knee osteoarthritis or, um, IT band pain. So, it's really cool data that I get from that, and I love using it. I try not to put too much emphasis on like gait and changing gait, but rather supplementing what your running form looks like with the right exercises for what you need and the right mobility stuff so that we can make your running form even more efficient without having to like okay, lean forward 5 degrees and make sure you've got a cadence of 180 steps per minute. Like, yeah, I try not to go down that route.
It gets really technical if you want to change somebody's mechanics, because it's a very difficult thing to do, is change something that feels normal at such a
Hmm.
fast pace of running to, okay, I need to make sure that my foot doesn't whip out this way, or I got to make sure that every step can't cross midline, or I need to take more steps. And it's like, okay, I have all of these things going on in my head, and then everything else goes to shit.
Yep.
And it's like, hey, let's, like you said, I love that. I just read an article from Running Physio. I like their information.
Me
So
too.
I'll plug them in. But the one of the biggest things that I took away from that is if you are going to make a shift to your actual mechanics while you're running, your gait, then you need to make the smallest change possible to prevent the symptoms from occurring. And
Hmm.
then everything else has to do with what you just explained.
Yeah,
So getting the
exactly.
exercises and everything else together so that your body can support how you run.
Yeah. And I think like as PTs, we are really good at with biomechanics. So maybe the tendency is to want to fix the biomechanics rather than what has been more shown to to be like a better long-term solution, which is addressing sleep, training changes, like training errors, like not increasing mileage too fast or introducing speed work when you're not ready for it, and then strength. those are like three things that are non-negotiables for me to talk about with patients, because if
Hmm.
we're not addressing those, then like who cares about running form? If you're
Yeah,
not getting that stuff, the basics and nutrition, I suppose, but um, you know,
you're going to get
it's a
hurt
little
if you're not recovering, which
right.
comes back to the overtraining principle. There's a lot of people that say, "Oh, you overworked it, so you have uh, an injury from that." And I'm like, "Well, you didn't overwork it, because that tells us that you shouldn't have been doing that much activity." And I'll keep re-explaining this to everybody until I'm blue in the face. Is you weren't prepared, your tissues weren't prepared and recovered to do that again. It's not that you did too
Right.
much, it's just you weren't recovered to do it again.
Right. And I think a great example of that, and I talked about this in the biomechanics webinar that I did, is like looking at certain really high level runners running form. There are certain people that I used to be like, what the heck? How are they not injured? Their
Hmm.
running form is terrible. Like they've got what we call like an egg beater gait, where their legs are just like going all over the place. And you're like, how the heck are they not injured? What they've done is they've adapted, like, their tissues have been like that for however many years they've been running. They probably started from a young age, and their tissues have just adapted to those stresses. Our body is so good at adapting to what we give it, but we just need to make sure that we're, one, doing the training that we need to in order to adapt, and then recovering while in between. It's
Yeah,
pretty basic principles, actually.
100%. People just try to push it too fast, and they don't adequately prepare, and then they get injured.
Yeah.
It sucks, but you see it every single day. I just talked to one of my friends in the dog mushing community. He ran the same trail race that I did, except he did the 60K version and I did the half marathon version. I was like, I would love to do the 60K version, but my body's not ready to do that, and I know that it's not ready to do that. And it's not my core race that I'm training for. It's more of
Right.
like a workout run for me. So my goal is to get through it without an injury. So that way I can keep training again on Monday, not
Exactly.
race it and then need to take a week off. And then I'm set back for the actual goal, which is to run 50 miles in October. So that's my A race and what I'm training for. And people don't quite understand that. It's like, hey, you can't run 26 miles for a 60K race the Sunday before it starts. It's like you need to have a little bit of a taper period. So like his leg or his foot hurt so bad after that race that it
Mm.
pretty much stopped him from finishing
Oh,
the
no.
race. So he didn't finish it. And it's a huge learning experience to not make it through a race. And I'll tell you the trail conditions, because we ran the same trails that they did. They just started earlier. They were hell. Like, this is a
Oh,
trail
no.
race, and we're up and down, and it rained from the start of it, and the
Oh,
trails
shoot.
were all slush and mud. So you're sliding and slipping. I walked a lot of it. It took me 3 hours and 8 minutes to get through. Well, it was a mile long, so roughly 14.1
My
miles
gosh.
versus 13. But I was like, man, I'm not getting injured here. I'm walking through all this, and I have my worn out road running shoes on rather than trail shoes. So
Oh, no.
there's a lot of errors,
No
but it's like
traction.
I went into it feeling good, where he went into it feeling hurt. So like there's a huge difference, and it's like, well, if you're gonna run a lot of miles the week before, you have to already be like in tune to support multiple back-to-back 20 plus mile runs. And if you're
Mhm.
not at that point, then it's like that was a major error.
Yeah. Yeah. Endurance athletes are they're another breed.
Yep.
They are addicted, I think. I think that's part of it, honestly.
Yeah, it is fun. It's why we keep coming back to it.
For
Before we
sure.
we get into your running journey, I want to make sure we at least hit that before you have to go here soon. Hopefully, your
Yeah.
intern doesn't come quite yet. Give us a few more minutes.
If you
Uh,
hear a knock on the door, that's who that is. But
okay,
I think we're good so far.
sounds good. Uh, so we went through the hip mobility stuff with your runner. You have, and we talked about gait training. You have a lever system, talk about that, what it is, and if you used it with this person.
Yeah, that is not something I use with him. He could get some mileage in without that, but I do love having that tool. Basically, if I'm gonna buy a piece of equipment, my main thought is it going to serve my runners? Because that's like who I specialize in. So the lever was kind of a no-brainer for me, and it was also something I've used in my training. So for anyone who doesn't know what the lever is, it's a body weight suspension system for the treadmill. It's like a giant bungee cord that you attach to whatever treadmill you have available. It's really lightweight, and compared to the cost of an Alter G, which is like a specialized treadmill that inflates and you can take up to like 99% of your body weight off with that. This one is a lot lower cost, but you can only take up to 45 pounds of body weight off. Um, and there's a scale that is embedded into it so you can actually see how much weight you are taking off. But really awesome way for people who are coming back from like stress fractures or are really sensitive to load at whatever injury site that they have. If we're not quite at the point where they can do body weight loading, it's a really great way to still get some running training in and get a little cardio. And also there's like something to be said about the movement of running, like your nervous system adapts well to that. Rather than doing biking for cross training, it's more applicable. Um, and runners tend to like being able to run, not aqua jog. I
Yeah.
despise aqua jogging. I will not do it again. um, anyway, I've used it with a few patients. I've actually let a few of my friends in the triathlon community borrow it when they've been injured. A few of them have some bone stress things that we were dealing with. So, yeah, it's been a really nice tool.
Not a lot of physical therapists have a tool like this. One in particular that I was at for clinical rotations had an Alter G. We used it with
Yeah.
one patient because how long it takes to set up and actually utilize this piece of equipment and have it blow up, get the cameras set up and all the other type of stuff and the technology that goes into
Oh,
that. It was just a recipe for disaster in an actual high-speed clinical setting where
yeah.
the lever system, it's really easy to use. And
Yeah.
well, at least it looks that way. I've never personally used one, but I've seen anybody use them, and like you can buy them as a regular runner. You don't need to be a
Yeah.
clinician to use them or buy them. And like you said, I think what are they, $1,000 something to buy a unit at home?
Yeah, I think it's like maybe 1,500 for the unit that I got, but,
Yeah,
yeah, I do offer, like, free demos, so if you're just, like, curious about trying it out on one of their demo locations, I think I actually have someone coming in next week to do
nice.
that, so, yeah, it's just a kind of a perk of being able to work with me is that you get access as long as it's in my clinic hours that I'm here, like, you can come in and use that whenever you want, which is really nice perk for my patients.
Yeah, which is super cool. You don't see a lot of physical therapy clinics, especially traditional in-network clinics that don't work with a lot of sports, have these equipment or these pieces of equipment at all. So you're not going to get a run easy uh, gait analysis with the actual feedback with the accelerometer and all of these other fancy tools that you have. You're not going to get lever system activity if you need it. You're going to get basic walking on the treadmill, and there's just a completely different world. So it's super cool that people have the option to go to somebody that actually works with this. Like, this is who they work with. It's just runners, bikers, people who are active endurance athletes, and a lot of people miss that. They don't know that that's even an option.
Yeah. I am really lucky that I get to work with this population. I love working with runners. It's been my thing for a long time, my jam.
Yep.
It's been
Runners
super
don't have
fun.
quit.
Nope.
They just
Nope.
keep going.
I am a lifelonger. I'm addicted to.
So that's cool. Thanks for taking us through that case. And
Yeah,
I'm
for
just
sure.
I'm just pumped to hear when people go through successful rehab and they really pick up the tools that they didn't have before, as far as I need to be doing these types of things for my body, and I really understand what's going on. And then ideally, as long as they stick to it, they don't come back for the same thing unless it's for like maintenance, whether it's recovery work with cupping, dry needling, soft tissue work, maybe even some joint mobilizations. Like we could do that just like a massage therapist does that on a monthly basis to help our athletes recover.
Mhm.
And it's something that people are like, oh, well, I'm not going to a physical therapist on a monthly basis because I feel good now when I graduated. It's like, well, you could. Everybody could use physical therapy on a monthly basis to recover. I would love it, you
I
know?
know, right? I wish I could clone myself.
Right.
Can someone do body work on me?
But yeah,
Be
you just
great.
gotta teach Grant to do all of that stuff on you.
Oh, man.
Then you
I
could
have
get
had
it.
him try to help me with dry needling once. Oh, we won't
Wasn't
do that
good.
again. He just is so afraid of needles. Oh, even just, like, tapping them in, that was all I asked him to do. I was like, "You don't have to I'll do the rest from here, just
Yeah.
tap it in, that's all I need," and he was freaking out. It's so funny having a boyfriend who doesn't know anything about medical stuff. We're just in totally different worlds, it's funny.
Uh, Part of it is they don't want to hurt you, but it's like, hey, it's fine. Like I would do it myself because
Right.
I could reach that area. Uh,
Yeah.
or it's like, okay, it's next to the spine. Just make sure you stay within like a thumb's breadth away from the side of the spine. Otherwise, I'm gonna start to get some neurological symptoms here. But I'll let you know if I do. So it kind of still safe to do it. Just don't hit my lung. Thanks.
Yeah, that I haven't had him go anywhere near my lungs. I don't
Yeah.
trust him that much. Sorry, Grant.
That's that's great. So I want to kind of finish up here. I know you're gonna have to take off pretty quick, but Dr. Felicia wrote a strength training journal for bodybuilders, passed off or crossed off, and then she put runners instead. I love that. Tell us what this is about. I didn't get a chance to read through it all, but even just the chapter headings. So you've got Strength Training 101, some tips, exercises, and examples, and then a way to track all of your workouts, sets, reps, all right here
Mhm.
inside the book. And there's even some motivational quotes mixed in there too. So
Yep,
walk us through this.
the corny side. I couldn't help myself with the motivational
I
quotes,
love
but,
them. That's the name of
um
my business is motivation, health, and wellness. So
true, true, true,
yeah,
true. Um, yeah, so I made the strength training journal because it was really out of necessity for the people in my class and then myself. And then I was like, well, if they're going to be using it, then and I'm going to be using it, then why can't I make this accessible for everyone? So, I walk people through like some fundamentals about strength training. I This is just kind of one of my philosophies is like arm people with knowledge and if you teach a man to fish he'll have fish for life if you do the fishing for him. I'm getting that phrase
yep.
totally wrong,
It
but you
made
get the
sense
idea.
though. Yep,
Yeah,
it made
you get the
perfect
idea.
sense.
So anyway, I go into some education and people can read that as much or as little as they want, but for runners, it's very running specific. Again, not we're not bodybuilders, we're not looking to bulk up. So everything in the book is about like how to adequately load without bulking and then why it's important. So unless you have a reason to do something, you're not going to do it. Um, so yeah, I have 6 months of the journal in there so that you can track your strength training progress over that 6 months. I have every 4 weeks I have like a dip where you're deloading a little bit and then the 8th week you're really dipping down so that you're getting that recovery tapering so to speak before you ramp back up again. So yeah, I've found it to be really helpful. I'm actually training for a marathon now. And I started using my strength training journal last week and it's been a really fun way to hold myself accountable because I'm like, oh, like I can't skip a page. I can't skip a week. I'll know it. I'll know I missed it. Just writing it, the act of just writing down my strength training every week is like more motivation for me to do it the next week.
Yeah, there's just something about documenting or writing it on paper that once you write it down, your mind's like, okay, I'm doing this.
Mhm.
versus if you have it just pulled up on your phone, there's just like this is a level of distraction. I love writing things down and having it all in one place versus like an app that I track everything on. I have an app that I use for all of my patients, so I put all of it in there so they can go through and track it, and it just makes it easy from the business side to pull it up rather than
Mhm.
having somebody bring this every time because I can already look and see it ahead of time. But for me personally, and a lot of people personally, to have all of their stuff in something like this is way better. I hate doing anything on it, my phone when I'm trying to actually put some work in because I just tend to get distracted and then like that it's like okay, well now that I've had this phone call, so I need to go make that phone call quick because it was important. It's like, well, so is your workout. Do your workout. You can make that
Yeah.
return the phone call in an hour, you know.
Yeah.
Get your stuff done, track it all in one place. You don't have to go on your phone and try and log it after. This like these are really helpful.
Thanks. Yeah, I'm hoping people will get some use out of it. I've had a bunch of people purchase it already, which has been really nice. Thank
That's
you
good.
for buying one. I appreciate
Yeah,
that.
you bet. Uh,
There's also something I forgot to mention. There's also like a link to videos in there for proper squat technique and deadlift technique. So if anyone's like intimidated by those two lifts, I just have a breakdown of those in there too.
yes, it's a QR code.
Hmm.
Yeah, I think this is a great intro to a lot of the main concepts, and it doesn't matter if you're like a high level athlete. To go back and to have the basics all in one area is great. Plus, if you ever work with somebody like you or like me, there's an entire list of definitions of like, for example, repetition. If nobody knows what that is, that's outlined right here. So it's like you have that all listed in here for people for common training principles that people need to know,
Yeah.
which is
Yeah, I
good.
mean, bodybuilders, they tend to, use all these phrases and that it's like if a bodybuilder was suddenly started running and they have to know what VO2 max and lactate threshold and what a tempo is. It's like, well, these are all foreign terms to bodybuilders, but now runners can know what those terms mean.
Yep. Yeah, I completely agree. I wanted to put something together like this myself, but I just steal yours.
Yeah, please use it. If it's helpful, use it.
So walk us through a little bit here about your. Did your person come? Your intern come?
Oh, I haven't heard any knocking yet,
Okay.
so
I know it's that time. They're almost late. Uh, Real quick, just fill us in on your marathon. You were actually doing a documentary style progress on Instagram. Are you like blog style?
Yeah. Yep. We'll see how consistent I am with the blogging, but yeah, I'm gonna try to take people through and kind of show them the rehab perspective of my training decisions. Like, unfortunately, I already had like a little tweak in my foot, and that wasn't from running. It was from construction work on my house. But I kind of took people through the decision making in my Instagram recently of how I decided if I should run through this pain or not. So it's things like that are part of the process of training for an endurance race that there's probably little gold nuggets that I wouldn't even have thought of posting about, but because I'm going to be taking people through the running journey, and the marathon is new to me. I've never run a marathon before. I've done like 5 halves, but never a full. So I'm curious to see how my perspective changes over the course of this training. Um, Maybe there's things that I'm going to learn that I can share with other people who've never done a marathon or, yeah, just want to learn more about running.
There's something to say for doing it
Yeah.
and getting out there and learning of what it's actually like to be that athlete.
Mhm.
I don't know if I can do that for a triathlete. I don't know if I can put myself through swimming and biking. Uh,
It is so fun. I still am gonna be doing, like, some triathlon training mixed in, because I now really value cross training as a form of running, training as well. I never did that in college, and I really regret not incorporating more cross training in because I just couldn't handle the running volume at the time. But yeah, I think it's a fun way to learn new skills. And if you're bored and you're an endurance athlete, learning how to swim will take up a lot of your mental time. So have fun.
I think that's a good way to kind of tie it all together. None of it really matters at the end of the day. Yes, it's our goals, but life's continue to go on. So if you're going to choose to do something, it's a long process to get to the physical level that you need to be at to run a half marathon, to run a full marathon, especially to relatively compete in it, not just like, oh, I got it done. It's like, well, you could probably walk it, or, half walk, half run, but you're going to be miserable for a while after, or potentially injured
Hmm.
unless you're really prepared for it. So the biggest takeaway that I have for somebody is like, if you're going to go through all of that, do it with good spirits and try to have fun with it.
Yeah. And that kind of goes back to the Greenville thing. Like we got a great community here. So I'm gonna have a lot of training buddies, thankfully, and they'll keep me sane, hopefully.
Yeah. Well, you're gonna do great. You're gonna make
Thank
it
you.
back to it.
Yeah, it's in
If
December, so I'll keep you posted.
if you had one thing to say to somebody who is injured and looking for the right path to go on, how would you kind of direct that person?
Ooh, wasn't a question I was prepared for. Let's see. It depends on the year you ask me, but this year, my advice. Wait, how would you phrase that question exactly? If someone's injured, what path?
Yeah, yeah. How would you kind of instruct them on getting help or like working through their injury? What would be kind of like a few steps and kind of the path that you would set them on?
So if you've got an injury, most people are in denial when they have an injury. So accepting that you have a place that hurts and you might need to address it is a first step. And then finding a professional who can guide you not only through like the physical aspect of it, but the mental aspect of it as well. For endurance athletes, a lot of our sport is mental. It's like an outlet for us. So finding someone who understands that is going to be a key component to your rehab process. But um, yeah, find someone who has the skills that you and I have where they're not going to just bring you back to the point where you can walk again or run 2 miles again. Like get you to the point where you can do that higher level thing. And it depends on the rehab person, but like your personalities should jive too. So what works for one person might not work for a different person. So if you don't do well with one person, don't give up, and just say PT is not for me. Um, yeah, find someone who works well with you and can be there to guide you through that process. It should be like a team effort. That would be my I don't know if that's great
Yeah.
advice. I feel like I didn't phrase that well, but
No, it's
hopefully it made sense.
yeah, absolutely. I think you're right on track. You need to find somebody that knows to some extent what you're going through and that can help guide you through it. And even just if it's a determination of it's safe to continue moving or not. And
Yeah.
that's a big factor and hoop to jump through. And if you go to the wrong person, they may not get what you're going through, especially when you talk about the psychological side. Runners always want to continue running. Same
Mhm.
thing with other endurance athletes. Even if they're running, they're going to run through pain until physically they cannot do it anymore.
Mhm.
So to
It's
have
a blessing and
somebody
a
who,
curse.
right, and to have somebody who understands that same mindset and has similar goals, like that's difficult to find in general, and that's where you kind of have to do your due diligence and go out and look. Be an
Mhm.
advocate for your own health. If you don't feel like your PT or whoever it is, personal trainer, other medical doctor, they don't get it, find the right person who does.
Yeah.
They're out there.
Yep.
And I
We exist. We're
That's
here. We're
right. Yep. Uh, one last thing. Your book is on Amazon.
Yes.
Is it? So I'll put a link in the description of this, the show notes, along with your information so that they can go and find you, Instagram, social media, website.
Yes, thank you so much for having me, and it was a really fun talk, and hopefully we'll do this again maybe in another year.
Yeah. Well, we
We'll
could
make it an
probably
annual
we,
tradition.
we still have super shoes to talk about, so
Oh my gosh, yes, we do.